rural health has dealt with challenges around workforce shortages, fragmented data, limited digital infrastructure, and the realities of trying to deliver care from siloed organizations with siloed information. Because we know it is not just policy that can make a difference, not just funding, but it actually takes a whole community working together in order to effect change.
80% of our counties are designated as frontier, which means we have less than 6 people per square mile. 90% of our counties are designated as health shortage, professional shortage areas.
So if you live in our most remote areas, you live 15 years shorter life than in our urban centres, which is quite a dramatic inequality in health in a first world country.
The critical piece to this, and one of our core missions, is making sure that access to data and the accessibility of that data, usability of that data, is not a barrier to our partners being successful.
That what I see as an end point of the introduction of clinical decision support into clinical care generally is less reliance on specialty care. That is going to do wonders for access to specialty care when that access is really needed.
For example, I had previously described the real-time prescription benefit functionality. That actually exists on a fair number of EHRs these days. It's not leveraged as much as it can be. We're finding only about 10 to 15% of providers are even aware that that potential is there.
Healthcare is a lot about relationship, and building those relationships, building that understanding, building that trust and that structure in place so that it is bringing services and support into the community and with the community, and not just coming in with a predisposed answer.
The power of health information to improve care for patients, to lower the cost of care for patients, is extraordinary.
We do not want access to data and the usability of data to be the determining factor in whether those communities and those providers can be successful.
The challenge for us has been to harness new technologies to transform rural health by extending services.
So our goal is to create a leveraged platform that can provide access to information that's usable and functional.
Our goal is to make sure that this technology is leveraged to lower costs, number one. And number two, our goal is to make sure that those people who've been let out of the technology ecosystem can get into it.
Each of these communities has their own unique challenges, and that there is no one-stop solution that is going to fit everybody's need. And building those relationships and that trust with those communities as we look to move forward will be critical.